morning.
toric error.
All the judges, I will show a video of 4 minutes. The formula which is better than estimateoffish.com, and it is having some advantage on the Barrett RX formula for toric lens misalignment. You can
Great.
see this.
Your time starts now.
Yeah, start the video.
Analyzer is an advanced realignment formula with new features. In this case, AT9 multifocal toric lens was implanted with post-op refractive surprise of 6 diopter. According to astigmatismfix.com, realignment would result in residual refraction exceeding 1.5 diopters, making an IOL exchange a more suitable option. In contrast, the Barrett RX formula suggests that realignment is the best option. Why are the results so different? And which formula is more accurate? This discrepancy arises because, in astigmatismfix.com, the power of the toric lens at the corneal plane is fixed based on the toricity ratio, whereas in the Barrett RX formula, it is variable based on the ELP, making it more accurate. Astigmatismfix.com requires only 2 input parameters, which makes it easy to use. However, the Barrett RX formula requires several additional inputs. We developed a new mathematical formula, the toric error analyzer, which provides realignment axis and residual refraction as accurately as the Barrett RX formula, while being easier to use than astigmatismfix.com. These are the 4 factors responsible for refractive surprise. Misalignment of the toric lens. SIA, error in PCA, which is the difference between the preoperative PCA value used in the toric calculator and the postoperative PCA value. Inaccurate toric lens power recommended by the toric calculator. The toric error analyzer is the first of its kind to calculate the refractive surprise caused by these 4 factors separately and display the results in the form of a graph. Here is an example. This is a case of against the rule astigmatism plus 0.37 diopter at 170 degrees. The recommended toric IOL was plus 21 diopter T2 at 176 degrees. Plus 22 diopter T3 IOL was implanted at 176 degrees. Postoperative refraction was plus 0.25 diopter at 56 degrees. Both realignment formulas recommended rotating the IOL from 176 degrees to 3 degrees to achieve emmetropia, and toric power of the exchange IOL increased from T2 to T3. Currently, toric error analyzer is only method to determine why axis rotation of 7 degrees occur and why the toric power increases from T2 to T3. It can be accessed on both Android and iPhone devices. Enter this URL or scan QR code. Click on toric error analyzer. This data sheet will open. Enter the postoperative refraction, toric lens power, and its current axis, and the analyzer will provide the best realignment axis and residual refraction based on the fixed toricity ratio, which is identical to the results from astigmatismfix.com. Next, enter the axial length, ACD, and A constant. These results are calculated based on ELP, similar to the Barrett RX formula. Finally, enter preoperative and postoperative keratometry, net astigmatism, or TK. The analyzer will provide the amount of refractive surprise induced or corrected by SIA and errors in PCA. It also provides the preoperative and postoperative power of the toric IOL. The toric error analyzer also provides a conclusion. In this case, rotating the lens from 176 degrees to 3 degrees will decrease the residual refraction from 0.25 diopters to 0.1 diopter. The preoperative power of the IOL was 1.17 diopters, which is close to T2. This increased to 1.34 diopters, which is closer to T3. The preoperative axis of alignment was 176 degrees, which was rotated 7 degrees counterclockwise, 5 degrees due to SIA, and 2 degrees due to an error in PCA. The new axis of alignment is 3 degrees. Thank you for your time.
Any comments on the...
I often surprise why do you have to find mistakes and everything in yourself only? Why do you think that there could be some problem in the company and there might be some mistake in the IL also? Many times you do all the calculations and find that the patient is accepting -5 diopter is spherical, and with no rhyme or reasons. So they are also at fault. So we have to check those factors also.
Actually,
A nice presentation.
the main aim is that when we having misalignment, So what we are doing, we are going to estimatefix.com. We have to enter many data. And when the eye is long and when the eye ACD is large, after misalignment, the recommendation that you should rotate the lens is different from the Barrett RX and the estimatefix.com. They are giving different result. And then you have to go to a Barrett RX also. So in our formula, you will access both together. So you have to enter only 6 data, you will get the result as estimatefix.com will give identical to that, because we are using same formula. Then enter 3 more data, then we will calculate the ELP, then we will give you the toric power as the Barrett RX is given. Additionally, we will also tell you that what happened in this case. Previously, Barrett toric calculator was telling that you have to implant T2 lens and in 176 degree. Doctor has implanted T2 Alcon IQ in 176 degree. Still after implantation, Barrett RX was saying that you have to rotate it. Why to rotate it? Why? What was the factor which caused rotation? Our analysis will tell it this. SIA has caused this rotation and error in PCA. So if there is some surprise, you get some surprise. So at least you can find out why I got the surprise. Otherwise, you will lose the confidence. Sometimes this happen in your measured PCA, measured TK. The instrument might not be measuring the posterior corneal astigmatism properly. So every time you are getting some error. So at that time you will get that this error is due to the error in PCA. So that whether I should use predicted value, measured value. So this is the additional thing which this calculator is providing. No other calculator are having these features.
Yeah, it's all the more good reasons to keep your data with you, pre-operative and post-operative. You should take all those data. Thank you so much. Very nice presentation.